Wadhwa, a warm welcome to the program. Tell us about the genesis of this particular task force.
So in Rome in October 2021, the origin of this joint G20 finance and health ministers, they came up with a communique and this task force was formed at that point in time. The reason quite simply was that when they discussed what was happening around in the world with regard to the COVID-19 pandemic, it was quite clear that the severity and hospitalization of the affected patients had revealed weaknesses in the pandemic prevention, preparedness and response, and also the health system and services, information and education. And also the pandemic had exposed significant shortcomings in the world's ability to coordinate a global health response. So there was a need to come up with some collaborative efforts to ensure that there's equitable access to safe and affordable, quality effective vaccines, also personal protective equipment, particularly in low and middle income countries. There was also an effect on the resilience of supply chains and vaccine distribution and administration. So the leaders at that point decided that whatever has to be done in this regard has to be anchored in the country's needs and context, and also recognizing the urgent need to act collectively to address the cross-border nature of health emergencies. Therefore, the work of this G20 informal group of financial experts was in focus, and this task force was aimed at enhancing dialogue and also global cooperation on issues relating to the pandemic, promoting the exchange of experiences and best practices, and developing some coordination arrangements between finance and health ministries of countries so that there is a collective action which is promoted, which addressed the health emergencies with cross-border impact. So that is how we've seen this task force, developing forward, developing options for coordination arrangements. And now we are seeing fruition of that in the form of the first meeting of this task force under India's presidency here in India, which is in the virtual mode.
Mr. Wadhwa, in the post-COVID era, maybe before COVID, there was a couple of countries who wanted to, kind of insulate themselves, were not very forthcoming with, cooperating with other countries on the health front. But in the post-COVID era, I think all the countries have probably come on the same page. And they do acknowledge the fact that, we have to prevent and we have to be prepared for these emergencies. And also our responses should be kind of global in nature, should be kind of, combined and joint in nature, isn't it?
That's absolutely correct, because I think there's a big realization that unless everyone acts together and identifies the problems together and finds the solutions together, and at the same time coordinates and finances and mobilizes resources for pandemic prevention, it would not work. The whole effort will not work. In fact, our own Foreign Minister, Mr. Mandviya, when a G20 Joint Finance and Health Ministers meeting was held in 2021 in October, that's the time he pointed out that we have, of course, importance of international health regulations, which has been brought to the fore, and also the need for strengthening global health governance. But how does one go about it? Because currently there are several parallel proposals being discussed in multiple fora. So it's, for example, the Independent Panel for Pandemic Preparedness and Response. Then there is the International Health Regulations Review, which is ongoing. There's also a need for a framework or a convention, an instrument of that kind for pandemic management. And plus there's a G20 proposal, which we are discussing right now, which is the Joint Health and Financial Task Force to strengthen the pandemic preparedness and response. So India has always said that we should have a central role for the WHO in this area, and that the multiple entities with overlapping mandates, while they're delving on this issue of pandemic preparedness and response, they must have a clearly defined complementarity in all their initiatives so that, it's woven seamlessly to create a global health emergency management architecture. And that precisely is the need of the hour. Also, we see that there are multiple stakeholder mechanisms which have developed, like Global Alliance for Vaccine Immunization. There's also Coalition for Epidemic Preparedness, for instance, or Access to COVID Tools Accelerator. And all these have a specific focus on affordable and equitable access. But no one is safe until everyone is safe, and everyone's development depends on trust and support of everyone else. So that should be the motto, to develop a common approach to this problem.
Mr. Wadhwa, in the last 1 week or 10 days, there have been reports that there is some kind of resurgence of COVID in China, and there are projections that in the new year, that is 2023, we could probably end up having a grim situation, and China could probably have 2 or 3 COVID waves with huge, mortality, which has been, projected. So doesn't that kind of impinge and give a sense of urgency to this entire debate and cooperation, so that even in the near future also, if something happens, the world gives a befitting reply and is kind of ready with its structure in place to handle and to give a appropriate response to that kind of a situation?
You're absolutely right. What is happening in China today is quite worrisome, and the projections are quite far-reaching projections, in fact, very grim. What can happen, of course, is not limited to China, because as we saw the last time around in the initial wave of the pandemic, we saw the travels from China not stopping, and therefore the world started facing the onslaught, being quite unprepared at that point in time. But fortunately, there's a big difference this time, in which one can see that not only is China prepared, but also it has stepped up its vaccination, although there are clearly reports which state that the vaccination program in China has not worked so well because of the efficacy of the vaccines, but that's a debatable point. Secondly, there's been a sudden reversal of policies from zero COVID policies to opening up and removing all mandatory testing in major areas. So surely and slowly, if not very rapidly, this issue can resurface again in the rest of the parts of the world, because we are all interconnected, at least economically nowadays. And the world needs to realize this, and that is why, fortunately, down the line, in 2-3 years down the line, there is much more of a sense of realization that coordinated efforts would be required to tackle this issue. Because of the various waves that the European countries, United States, and Asia itself has gone through in the past, obviously the local immunization programs have developed quite a bit. A majority of the population seems vaccinated. If you leave aside countries in Africa and Caribbean and Latin America, most other parts of the world have been fairly well inoculated. But at the same time, COVID has new variants all the time. And when that happens, there is an immediate response which is required from a central agency. And India has always been saying that central agency has to be the WHO. Which coordinates all the parallel frameworks that are now undertaking research and work in this area.
Mr. Wadhwa, you're talking about immunization early in the phase of pandemic, when the vaccine was under development, or at the time when it was just developed and production had started off. In India, we started having a massive campaign for vaccination under the leadership of Prime Minister Modi. Even at that particular point in time, India, having its said principles of Vasudhaiva Kutumbakam, Prime Minister Modi made it very clear that despite the fact that we need, millions of doses of the vaccine ourselves, still at that particular point in time, Government of India opened up exports to other countries to help the member countries as well. So India showed that kind of magnanimity. In times to come, can we expect the same magnanimity from other member countries also, whether it is pharmaceuticals or development of, another set of vaccines? Can we expect all that cooperation and magnanimity from other members also?
We have seen how much India is prepared to give to the outside world. We have a proven track record, as you very rightly pointed out, and that policy will continue going forward. In fact, India and some other BRICS countries, especially South Africa or Brazil for that matter, have taken the lead in WHO in trying to look at waivers of IPRs, patents, etc., and also making sure that vaccines are available at affordable prices in different parts of the world. So in that process, India is not at all shy of sharing its technology, of opening up its vaccine expertise to the rest of the world. But the question remains how much big pharma, as we call it, in the developed countries is willing to share that with the poorer countries of what we call the global south. And that's the main reason why pressure on their governments is such that there's been still no consensus on sharing that, and also making sure that the IPR restrictions are lifted, not only manufacturing of vaccines, but also in terms of equipment, which India has been pushing for in WTO and of course in the WHO. So it still remains to be seen how much cooperation we will see going forward. From the past experience, it doesn't seem likely that the big pharma companies will entirely open up to the outside world unless there is a change of heart and there is a pressure from their respective governments.
Mr. Wadhwa, on that optimistic note, let's wind up this discussion. Thank you so much for joining us.